Massage technique number 1 for chemo-induced peripheral neuropathy. I will demonstrate on the hands. The same technique is used on the feet. I am not using any oil or lotion for this massage because I want to maintain a firm grasp. If oil or lotion is soothing to you, that's fine. Just use it sparingly so as not to impede the grip of your hands. First, I hold on to the tip of my finger, or toe if I were working on the foot, between my index finger and my thumb. You may use 2 fingers and a thumb to hold if that feels more stable to you. I massage the tip of the digit to stimulate the tissue and break up the cell debris. Then I use my thumb to inchworm down the finger or toe from the tip towards the rest of the hand or foot. Go past the point of numbness into the area that feels normal. My pressure isn't deep or painful, but it is stimulating the tissue beneath the thumb, which is what I want. This will increase the circulation to the area, which provides oxygen as well. I release my thumb and bring it back to the tip and start again alongside the area I was just at. You never want to move in the direction of your fingertips or the tips of your toes. Always move away from the tip. I continue doing this method until I've covered the circumference of my finger or toe, and I feel it has been massaged well. If you've had 1 or more axillary lymph nodes removed from your armpit area, you need to take precautions and not massage longer than 2 to 3 minutes on the hand that is on the affected side due to risk of lymphedema. And to reiterate, the massage pressure should not be deep but firm enough to lightly move the tissue, which increases the circulation to the area. Massage technique number 2 for chemo-induced peripheral neuropathy. If neuropathy symptoms have progressed past the toes or fingers into parts of the foot or hand, begin the massage at the edge of where the symptoms start. So if my numbness, tingling, or burning sensations end about here, I will begin at that edge of those symptoms and use my thumb while maintaining a firm grasp with the rest of my fingers to inch down from that line towards the rest of my hand or foot. I release my grasp after going a short distance and start again at that edge, right alongside of where I was just at. Once I've covered the tissue below that line, I will start again, but this time I will go slightly above that line while still keeping the movement away from my fingers or toes. So I am now in the tissue affected by symptoms. As I continue this massage, I will gradually progress to my fingers or toes, making sure to cover the circumference of those digits, but remembering that the direction of the active massage is always back towards the rest of the hand or foot, not towards the fingertips or toes. Once you've reached the tip of the finger or toe, finish with technique number 1 to cover the entire digit. So always start by stimulating the tip of that toe or finger and inching it down, covering the entire circumference of the finger. And you will progress from the pinky in, or if you started at the thumb, it doesn't matter the order, but just continue with each, always starting at the base of the digit, working up all the way to the tip, stimulate that tip, and come on down. Massage technique number 3 for chemo-induced peripheral neuropathy. This technique is used when neuropathy symptoms are severe and have progressed to the entire foot or hand, and it is too painful to massage. Gentle, sustained compression and holding of the affected area helps to bring soothing comfort to the nervous system. Either place the palms of your hands together, or place both hands on the top and bottom of your foot, or have someone else do this for you to provide relief. Holding the area of soothing compression may help to calm the nerves.